Hello friends! Tonight's live, I'm so excited to announce, is going to be with a very special guest, Nurse Rachel Dewar, who has joined the team at Emily Miller Aesthetic Medicine. And so I'm absolutely thrilled for you to meet Rachel. And I want you to book in with her. It has only a couple of spots available left in the month of July. So this coming Tuesday, July 16th, she has a couple spots. You should snag them and tap my link in bio and you can book through Jane App with Rachel. So without further ado, we are going to talk about our topic tonight, which is lip filler trends that are out versus in. What we are seeing our clients requesting with lip filler, what we can accomplish with lip filler, and how we can achieve your lip goals. So Rachel is an absolute expert in lip filler. She has trained with the very best, the famous Julie Horn. Rachel trained personally with her and has learned some amazing techniques for filling lips with really beautiful results. Her results speak for themselves, and I'm so excited to bring her on for this live. So let's see. And if you have questions, type them in the comments. Should be on in a second. There we go. Hi. Hi, gorgeous.
How are you?
I'm good. You look so good. I thought you worked at the hospital today.
Yeah, I did.
And then you got like all glammed up for our life. I love it.
For this. Yeah.
So thank you for taking the time. I'm really excited to talk about lips because this is your specialty. And when we work together, I'm always so impressed by the way that you visualize lips and you know exactly what they need for that individual and have like a very specialized approach to each unique set of lips that you see. So we're going to talk about the common requests that we're getting from our patients, kind of where we see lip filler trends going in the future from where they've been in the past. I think people are kind of becoming aware of potential complications of overdoing lip filler. We're seeing, more and more images of that now, and people have sort of different goals to get away from that.
Yeah.
So what would you say, Rachel? Like, what is your experience with what your clients most commonly request for their lips?
I think like even in the last year or so, people have gone from wanting really full lips to actually like having natural looking lip filler is kind of like a buzzword. So yeah, that's really exciting because I think that it makes the actual longevity of like your story with filler just more aesthetically pleasing in the long run.
Absolutely.
Mhm.
Yes. So how do you achieve a natural looking result? Because you're right, it is a buzzword and everybody will, well, not everybody, but a lot of people will market themselves as giving a natural looking result, but like natural is subjective, So
Very.
people have a different idea of what looks natural than others. So what does natural mean to you and how do you achieve that?
I think natural to me means respecting that person's anatomy and choosing a product that's going to integrate nicely with the tissue of their lips.
Mhm.
And that's like regardless of age as well. Because I do think that you can have natural looking filler on a 25-year-old and also women in their 40s, 50s, 60s, and 70s.
Absolutely, yeah, you can. And so you mentioned product choice is really important when determining your own treatment plan. Like, yes, depending on your age and depending on the size and tissue of your lips to begin with, what your own anatomy is, that's going to determine what we can achieve and what the outcome will be.
Yeah, exactly.
So you're never going to push a small lip too far because it's not going to work out for you. It's just going to go out of the lip tissue and migrate into this space up here. And so we have to go little by little. And then also you reach a point at which now you're just done. You know, you're maxed out. Everybody has their max limit, and you don't even really want to come that close to the max, because if you do, you're not going to see like the wrinkles in the lips anymore. They're going to look like an overstretched balloon, you know, like
Yeah,
they
a
lose
little
their
bit of
kind of
wrinkle
unique
is
fingerprint.
definitely good. Yeah, yeah. And I think that's also why people hear that lip filler is a process as well, because every session that you have doesn't mean that you're necessarily adding a full syringe every time. I think it's that, like, it makes a good injector to know when to say no and to stop with the amount of filler, because you can always come back and add more.
Absolutely, yeah. And doing it slowly is the best way to achieve a result that really suits you. So just letting your lip tissue accommodate to the small amount that's been added, and not overstretching it in any one session, because you will get migration if you do too much.
Yeah.
Especially when you're building multiple sessions. So say somebody achieves a result that they're really happy with, when should they, like, people often ask, but when do I do it again?
Yeah.
I always tell people that's like, depends on the individual. I take it on a case-by-case basis. I'm always assessing your lips to see what they look like, so I can't really tell you, sure, we'll do it a year from now, because it does depend on the individual. It depends on the product that was put in there. Some of them break down faster than others. Some of them have a little bit more like oomph to them, and they get metabolized a little bit slower than ones that are super soft. They might go away a bit faster, even though they're giving kind of the most natural look. So it depends on your treatment plan.
Yeah.
But how long would you say, do you tell your clients kind of on average, if they're not wanting to build in size, but they just want to maintain, how far do you find that your lip filler kind of takes them?
Yeah, I find if they do one session to start off with and maybe another session like 6 to 8 weeks later, I find people can get closer to a year and a half with their treatment before they come back and they're like, I need to get more lip filler. But it's definitely personal preference as well. And I think that it is a thing of the past. Having like lip filler every 6 months or lip filler every year, because that's just going to put you at more risk for migrating.
Yeah, and the more times that you have it, the longer it sticks around. So there's a compounding effect where once we place filler over filler, it lasts longer. So anywhere in the face, really, if you've had more than one session of filler in one area, you're going to get a longer lasting result.
Definitely.
So it could last you years even. Say you've had your lips done like 3 times, you might not want to touch them again for years.
Yeah. And I think that's another thing too, is like you might want to look at other areas around the lips just to make sure everything's in proportion with what you have going on there.
Absolutely. That's a really good point. So that's something that I wanted to bring up, of where lip filler is heading is we're seeing less of just treating lips in isolation, and we are seeing more of people looking at, you know, what does the chin look like in relation to the lips, and what are the proportions there to support that enhanced lip that you now have, because it's going to look odd if your chin is recessed or too small and then you have, you know, these now enhanced lips. It's not going to be as flattering of a result as if everything is in proportion. So I think that that is definitely a trend of where lip filler is headed, is that people are looking more at that full face balancing, especially like lower face balancing when looking at lip filler.
Yeah, definitely.
And treating the chin and the chin shadow. I always say, like, don't treat the chin without the chin shadow.
Yeah,
the two go hand in hand.
You're so good at.
It makes a big difference. And I'm actually this month getting my chin and chin shadow treated, you guys. So you better believe I'm going to document it. I'll show you before and afters. I'm very excited. I'm flying to Georgia to get my filler done by Dr. Doan. She's amazing.
You must be so
and I'm going to do a training with her too. So it's going to be a great trip. But yes, chin and chin shadow are very important to consider along with lips. And don't just fill your lips and cheeks. That's when people get looking for it. So Rachel, when she says maybe consider your preauricular, or maybe your temple is actually what you need. So a trend is being aware of like multiple treatment zones and what we call transition zones, and that facial harmony and balance of all of the features of the face. So yes, we want to have, lovely, pouty, youthful lips. It's such a beautiful feature, but if it's out of balance or proportion to your other facial features, then it doesn't look so lovely. It looks like something is off.
Yeah, and
And it's a
we
giveaway
were,
that you've had
yeah,
filler.
we were talking about that like with more mature clients as well. It's like, I think specifically for mature clients, it's important to address like the surrounding areas, and then the lips are like the icing on the cake, just
Mhm.
because I think that it can look overly augmented if you're just treating the lips to start off with.
Absolutely. And you need to give that support. So as we mature, the corners of the mouth become downturned because of this muscle here that's pulling, and the ligament here that creates a fold of skin. So we get the marionette line. So we get this like shadow here at the corners of the mouth, and that needs to be treated properly to support and frame the lip. So that everything goes together. And I love treating lips on mature clients. They will tell me, yeah, I don't want to look like a 20-year-old. I don't want to look ridiculous. But what I do want is some hydration, or just to have be able to see more of the lip again, because this muscle turns down and in as we age, and we sort of can't even see, especially the upper lip anymore, and the lower lip can turn in as well. So we lose a lot of natural size of the lip as we age, and people just want to get a little bit of that back. Another procedure which we don't provide, but it's good to know about, is a surgical lip lift, which is where the philtrum, which lengthens as we age, can actually be cut here and some skin removed, and it brings the height of the lip up. So we also have to be realistic in what we can achieve in terms of like creating height for a lip of a woman in her 60s. Maybe that would be achieved with a surgical correction as well, and not just filler, because if we're sort of over promising or trying to accomplish things that aren't really anatomically accomplishable with filler, then you can get into trouble as well, and it won't look good.
Totally. Yeah, another thing that kind of goes along with that is using Botox in people who have lips that curl in.
Yeah.
So you can actually have Botox along the top lip so that it doesn't curl in, and you can combine that with filler as well to help with like a gummy smile.
Yeah.
Mm-hmm.
I think that's another trend where things are headed, is people are filling their lips maybe a couple times over a couple years, and then they get to a point where they're really happy with them, and then they just maintain with getting that Botox that Rachel's talking about. So it's a Botox lip flip, and it can show more of your natural lip tissue, or if you have filler, it can kind of make it look like it's lasting longer without just reaching for more filler. If you want that extra oomph, do the Botox there and just continue with that, right? That's a nice way to get that longevity out of the treatment, where you're not overfilling, but it can make your filler just go farther and last longer.
Mm-hmm.
Yeah. Okay, did we want to mention anything else? Asymmetries.
Yeah.
I feel like you're so good at treating asymmetries, Rachel, and it's a really tricky thing to be able to do. Do you have any like tips or tricks? What are kind of your techniques? I know you learned a lot from Julie Horn, and
Mm-hmm.
I love learning your techniques with that. But when we had a patient who, like, you knew just what to do to one Cupid's bow versus the other
Oh
in
yeah.
order to create symmetry, and you're like a magician.
It's really cool. Like, I think it's a lot of like learning how the filler actually will move the tissue of the lip. But yeah, if you have like one pointed Cupid's bow and one rounded Cupid's bow, you can quite easily, is that what you were talking about?
Yeah.
Yeah, yeah. So you can get them. I find it easier to make the pointy one, or easier to make the rounded one pointy, but I think like for a prettier heart shape, you want a more rounded Cupid's bow. It looks more natural.
Mhm.
So instead of doing like a linear thread up in the rounded Cupid's bow, you skip that and you just add linear threads on the sides of the pointed one.
Mhm.
Yeah.
Yeah. We're doing injector speak now for the injectors
Yeah.
on the slide.
Yeah.
Yeah. They're taking notes.
But it
Um,
works really well, especially if you do it with a more firm filler. You can really get it to
mhm.
round off.
Yeah.
Yeah.
The consistency of the filler definitely like gives you more ability there to work with symmetry.
Yeah.
Okay, so we've talked about loss of volume due to aging, hydration and wrinkles. Some people, believe it or not, don't want to augment the size or shape of their lips with filler. They just want to make them look a bit more hydrated, a little bit less dry, a little bit more like plump and smooth out some of the wrinkles that we might get in our lips. So my favorite product for that is Revanesse Kiss. It's super soft, and that is what I reach for with people who just want hydration of the lips. So that's another goal. Like you don't have to necessarily want them bigger or a different shape, but we can just hydrate with filler. And then some people do want a subtle augmentation and they do want to enlarge their lips. And that can look really nice if when in the hands of the right person who knows like just the right size to go
Yeah.
based on your facial features as a whole. And the size of your lips to start plays a big role too. Yeah, I've seen some beautiful work from injectors who can do like the really juicy lip, but most of the time those lips have a lot of real estate to begin with.
Yeah, definitely.
Yeah,
It's a
it's not
lot harder
the
to
more petite lip that becomes the Angelina Jolie lip. Like that's not happening.
no, but
Yeah.
it can be like quite full in a few years if they
Mhm.
add slowly.
Yeah, if they go slow enough.
Mhm.
Yep. Well, I hope that this was helpful to you viewers. I've been busy chatting, so I didn't check if there were any questions. I'm just kind of scrolling back to see. Rachel works magic. Yeah, she really does. So book in with Rachel. She is seeing clients at Emily Miller Aesthetic Medicine in North Vancouver. She lives on Vancouver Island and is kind enough to commute to us. So I'm so happy to have her, and she only has a few spots left for July. And we have a gift that are going to clients that book in with Rachel in July. You get a Illuminating AOX Serum ZO. This is the 50 ml. You get the 30 ml. It's a little bit smaller, but it's a $100 value. And I love this product. So if you use,
Yeah, I wear it
yeah,
every
that's
day.
why I picked it. It's
Yeah.
Rachel's favorite. And if you use Daily Power Defense, this is the exact same product, but it has this really pretty dewy mineral finish. So I'm going to show you what that looks like. I'm wearing it like under my makeup right now, but this would
I'm wearing
be
it right
the
now.
last thing that would go on before your sunscreen so that you see the really pretty, like this
It's so pretty.
glow. It just makes your face glow so gorgeous and hydrated. And you can use that as like a highlighter almost if you want. And yeah, it's amazing. So it's an antioxidant serum. It's all the same ingredients as the Daily Power Defense, which is like their bestseller. Everybody loves that. And so I love using this one in the summertime, or you could use your AOX in the morning and your Daily Power Defense at night, because who cares if you're glowing in the dark. um, yeah, so come in. She has a couple spots left, and book through my link in bio through Jana. Thanks, everyone.
Yeah,
I'll see you next time. Thank you, Rachel.
Okay, bye.